Good morning, all respected teachers and my dear colleagues and faculties. I'm Dr. Ganesh Ankam. My topics today is my experiences with innovative IOS invasive and non-invasive methods of orthopedic problems. I have included almost all combination of IAOS methods in my cases. First case, this patient is around 60 years old, had severe osteoarthritis. Myself and Dr. Amar Babu performed a successfully knee arthroplasty at my friend's hospital. Post-operatively, patient was absolutely fine, but the patient has diabetes and hypertension. After few days, I lost his follow-up. Then he landed up after 3 weeks to my friend's hospital. After discharge, he went to the osteopath to have a ROM exercises, like he did a vigorous flexion exercises, and he developed a mild wound gapping and self-treated with talc powder as a stitch powder. And he presented to my hospital with severe pain, fever and chills. Then on inspection, I saw the wound is like this. Then when I opened one stitch, somehow he covered all with the talc powder. I removed all that and there was a 1-inch hole. I just put my finger into the joint. So I could feel implant, poly and some remnants that were powder balls. Then his lab reports were ESR was 120, CRP 64, WBC were 23,500 and RBS was more than 350 and HbA1c was 9.6. And we decided to open the joint completely and debrided thoroughly, and whatever the tissue we have seen that is not viable, removed all the tissue and wound irrigated with ozone. We have irrigated thoroughly for almost 45 minutes and we kept a drain and we changed the poly also, and daily we have drained with ozone saline. After washing, we gave ozone infiltration into the joint, kept for almost 15 minutes. We did like this for 2 weeks and given IV antibiotics for 3 weeks and oral antibiotics for 6 weeks. Before, when we operated, we achieved only 90 degrees of flexion, but to my surprise, after all the wound healed, we got almost 110 degrees of flexion, and the patient was very happy in spite of struggling all these things. He was very happy that he got almost 110 degrees of flexion. He was afraid of going under all these things. The other leg, right side also, he needed a knee replacement, but he said, "Sir, I don't want any knee replacement now. You just give me the block. I will be happy." To my surprise, he is very happy with intra-articular ozone plus beta 2, beta 3 blocks and Salhotra portal to the right side. He is very happy with the both legs now. And the second case is complex rheumatoid arthritis with complicated Baker cyst. Patient is very young female, 17 years old. Chief complaints were multiple joint pains, small and large, progressive swelling and inability to walk. She came to our hospital in a wheelchair. We admitted her and thoroughly investigated. We knew that she had old reports stating that rheumatoid arthritis and joint swellings and mobility impairment was there. I have given her started with IV steroids and Mukherjee regime. Given her 5 major autohemotherapies and 1 hydrogen immune drip. After that, we achieved complete symptomatic relief with Mukherjee regime, and thanks to Mukherjee regime, we gave her 5 MASTs also. She was happy for almost 6 months to 7 months, but suddenly she developed a large and hard tender cough swelling. Then I asked ultrasound. The ultrasound suggesting was suspicious of malignancy. In MRI, I got a complicated Baker cyst of size of 12.4 into 7.1 into 3.5 centimeters. So it was connecting to the knee joint. So I had a discussion with Prakash sir and a surgical oncologist. Then Prakash sir asked me to do a aspiration and ozone infiltration, but oncologist advised for surgical excision of the complete cyst. Then I aspirated almost 500 ml of fluid and ozone infiltrated in the same needle only. The swelling has extended to the quadriceps. Then I thought prompting consideration for surgery, but surgery was postponed for 3 weeks due to surgical oncologist availability. Then when he came back, then we asked that patient to come for surgery. On follow-up, swelling completely resolved and the patient was asymptomatic. Surgery was not at all required. She is very happy and there is no tenderness, no hardness, nothing was there. She is very happy. And continuing her on Mukherjee regime on and off in once in a 6 months MAST. So this was the before aspiration and this is after aspiration of 3 months. So the third case again a rheumatoid arthritis with stiff wrist joints, bilateral wrist joint stiffness. She had treatment for almost 3 years somewhere else, and she developed stiffness in all joints but more on both wrist joints. I have given her intra-articular ozone. This is after 1 year. Her wrist joints are very comfortable.